I'm tired of being right.
The sportos, motorheads, geeks, sluts, bloods, wastoids, dweebies, dickheads, they all adore him. They think he's a righteous dude.
Just looking around here, I can tell you're a genuinely dirty person.
Man, I'm tired of being right.
I never thought anybody could forget so much so fast without a severe blow to the head.
I'm a dude playing a dude disguised as another dude. Tell him, McCluskey. Tell him what time it is.
Just the facts, ma'am. Just the facts, ma'am.
A chat with you and somehow death loses its sting.
Moon River.
I never thought anybody could forget so much so fast without a severe blow to the head.
Once it was reluctantly aroused. It was hard to get it aroused, and it is hard to get it aroused, but we got it aroused.
I'm a dude playing a dude disguised as another dude. Tell him, McCluskey. Tell him what time it is.
This is my sister. You can all have her. I hear she's very good. All right. Stop right there, and I'll bring back the sun.
Did you hear that?
Yeah, it's a dick fur.
What's a dick for?
To pee with.
Every minute you don't tell us why you're here, I cut off a finger.
Mine or yours?
Yours.
Damn.
What do you say we cut the chit-chat a-hole?
Just looking around here, I can tell you're a genuinely dirty person.
A chat with you and somehow death loses its sting.
Once it was reluctantly aroused. Once it was reluctantly aroused. It was hard to get it aroused, and it is hard to get it aroused, but we got it aroused.
Just looking around here, I can tell you're a genuinely dirty person.
The sportos, the motorheads, geeks, sluts, bloods, wastoids, dweebies, dickheads, they all adore him. They think he's a righteous dude.
Excited to get to you guys. I'm not muted. I'm here. Hello. So I was so excited. I forgot to put my. There's always got to be something. There's always got to be something. This is much better. There you go. So so I ran downstairs to grab something really really quick. I'm not on mute. I'm not on mute. There is sound. Trust me. Here it is. So, I have to admit, I was a little bit, I got online today. I looked at my regular presidential schedule that I go through, so we can have something to pilfer with ridicule today. And so and I was like, I just saw him like signing the proclamation of, like National Nurses Day. My mom's a nurse, so that always makes me very nervous when he touches on territory that has to do with my own parents. I think all of you feel that. And hey, Noel, how are you? So I was like, oh, well, he's probably just going to, do a little thing. And then I was like, no, leave it to Trump to use this as an excuse to make up for the lack of task force gatherings, which is effectively what he's doing. Yesterday was a straight up campaign drop off. And I still stand by my belief that he was drunk. Thank you, Kelly. And by the way, very schmancy typeface. That's a truer way of putting it. So, anyways, I stand by that. And and hey, Moto, how are you? And Carl and everybody, good to see you. Can't Stop Lying. How you doing? So, so I was like, oh, well, maybe there won't be much, and we'll dive into her stuff, or I'll go back and look at this ABC interview he gave, which was incredibly embarrassing in and of itself. And lo and behold, Trump decided to stretch out the signing of National Nurses Day into a 45-minute, brain wag. And I am convinced. I only watched a couple of moments of this because I saw how long it was, and I was like, I want to do this raw with you guys. But I was like, does he take questions? So I fast forwarded it into where he starts to take questions. And okay, so first of all, let me just go straight to the I don't even know how to put this. Okay, let's go straight to, this is what the gathering looked like, all right? Here he is. These are the nurses they had together. Now, check out the dude just to Trump's right. Watch that guy throughout this whole thing, because he's looking at Trump like he's like I would say about Hunter, a squirrel loose in the apartment. Thank you, Rebecca. I'm sorry we'll miss you at work, but this will be worth rewatching, I have no doubt, because oh my God. Oh my God. And watch, so it's that dude right over there in the scrubs shirt on the other side of Trump, leaning away from Trump. Look at him. Look at already this dude is like, what? And and maybe he's just trying to stay out of the camera shot, or he saw them setting something up. But I think it's the smell. I'm going to go with it's the smell. But also, watch his hands later on in this. Because holy shit, he's right in the background. He's right behind Trump the entire time. Okay, let's go with this thing.
Welcome so many extraordinary nursing professionals as we celebrate.
Oh, look at that, right out of the gate. And this seems quiet, by the way. I'm gonna bring him up a little bit. He's quiet anyways, because they're just using the house mics of the place too. So I'll see if I can boost it any way I can. But
National Nurses Day. That's a very important
dude, hey, give a round of applause. Failed round of applause from the dude.
Day, and I've been talking about it for the last 2 months when I watch people running into those hospitals and putting on
their gowns and they're throwing them all over the place.
Outfits.
I've yet to see that video. I don't know what you're talking about. The lady on his left is like, oh, you precious little man. What time do you get your pills? We got to get him a little cup of pills.
Their protective gear, and they have nothing on their mind except helping people and making people better. It's an incredible.
Must be a complete mystery to you. Boggles the mind.
And you just.
By the way, look at his remarks, just laying on top of the thing that he's going to sign. Now, I'm going to go out there and say to his staff, if any of you are watching, and I'm sure one of you is, you've got to monitor this every day. If you're not doing your job. Give him bigger type. Or straight up start using cue cards. Because as bad as it was, it gets worse.
And thank you for calling us warriors, but you are warriors. That's what you are, incredible warriors. America's nurses are waging a heroic war against the invisible enemy. They're fighting on the front lines of the battle, risking their health to save lives.
To save lives? Oh boy.
Of fellow citizens, and honestly, to save lives, like we say about the police, to save lives of people they don't know.
Which is a shock. Why would anybody do that? Why would you bother? If you're not getting something back, why would you save lives like that? We're not going to send aid to New York unless they give us something in return. What do they think? They get help from the federal government just by being a state?
It's dangerous, and it's people they don't know, but they're saving lives. And
I don't care about anybody that I don't either owe money to or doesn't owe me money.
They're doing them in record numbers. History will forever, and I really mean that, forever.
Oh boy. I'm really forever, history will ever remember weather is weather.
Remember how our nurses answered the call of duty in America's
wait a minute, what? America's
hour of need.
Hold on, back up a second. Let's roll straight through that one.
Will forever, and I really mean that, forever. Remember how our nurses answered the call of duty in America's hour of need. And
America's hour of need.
I think that in terms of a brand, you take a look at the nurses' brand, I don't think it's ever been higher than it is right now.
Oh God, it's not a brand, it's a calling. They care. Like, he literally can't see anything except through its window of marketing. Good Lord. That's a good brand, the whole saving people you don't know. I'm going to borrow some of that brand. Probably at some point along this way, I'm going to basically say we're doing the same thing. I'm saving people I don't even know in states that didn't even vote for me. Is there a way I can stop that? Ha, just joking. But they'll say I wasn't joking, but I was. Anyways.
Now, it's very important. We're joined by Vice President Mike Pence, Secretary Alex Azar, and Ambassador Deborah Birx. Also with us, our President.
AIDS ambassador. She's not an ambassador to another country. I love how he's reading these people like he just met them.
The American Nurses Association, Ernest Grant, and the President of American Association of Nurse Practitioners, Sophia Thomas. Thank you all for being here. We really appreciate it. Thank you very much.
I thank you for letting me use you as human props to cover my ass during my time of need.
Fantastic. We've rallied the full power of the federal government to defeat the virus and support our healthcare professionals. I proudly signed legislation providing $175 billion for.
Look at her. That woman is like, please don't start reading like accidental swear words. I have somebody on our wing that does that, and he's just, oh Lord, like she's totally in bless your heart mode.
Hospitals and other healthcare providers. FEMA, HHS, and our private sector partners have distributed over 1 billion pieces of personal protective equipment, and I know you're getting a lot of that equipment, not quite 1 billion pieces, but you're getting a lot of great equipment. We made so
He's had 1 billion gloves, and he's had that stuck in his head. Yeah.
Progress.
No one's wearing a mask, no social distancing. Yeah. Everybody there had a test, though, so, okay.
Men and women in this room today are true American heroes.
Agreed.
Luke Adams is...
Well, I take that back. The nurses that are there, and the nurse practitioners and the people that work as nurse practitioners and for them, yeah, Azar and Pence, not so much. You don't get to just... Like, he literally, that's just him including himself. The people in this room, who's in this room the most, honestly, are true American heroes. The nurses, and also, yeah.
He's a nurse of 11 years. He lives in Bloomsburg, Pennsylvania, good place. When he heard the call,
I don't hate Trump. He disgusts me. It's a different emotion entirely, and I'm not I do this because as a comedian, this is better for my country. If we don't deify morons,
volunteers.
That's what this is about.
In New York, Luke drove to the epicenter of the outbreak and slept in his car for 9 days so he could help care for the sick. Luke is currently still in New York working to protect his fellow citizens. And Luke, I'd like you to say a couple of words. Where's Luke? There he is. Luke, please.
As the president said, 2020, well, today is Nurses Day, but 2020 is actually the year of the nurse. And so it's only fitting that we should be faced with one of our greatest challenges yet.
Yeah, no, dude, that's okay. I appreciate where you're going, but
a lot of us have been forced away from our partners, turned away hugs from our children. We slept on concrete floors or in cars. And we did these things not for our own benefit or safety, but we did them, as he said, as the president said, to risk our lives in the service of a stranger. And there is no greater love than that. And, the world may never know all that you do behind that curtain, but I do. You fight hard to save the ones you can, and we carry with grace the enormous burden of the ones that we can't. And there's been a lot of those recently.
Another dude, look at Trump. Like, okay, you're done. Okay, you're done.
We represent the very best of the human.
Well, except for me.
Capacity, and I've never been more proud to call myself a nurse. So thank you, and thank you to all the nurses.
And thank you, Luke, and you'll answer a couple of questions from the media because I think they'll have a couple of questions. What you go through and how you go through it with the bravery. We appreciate it. Thank you very much. Beautifully done.
It's funny that you're staying in your car in a place where I have 2 empty hotels. That's interesting. That you slept in your car. You did? You slept in your car. And I had a whole hotel with no one in it. That's interesting. I just find that interesting. See if you, okay.
Also with us is Marty Blankenship. She was a nurse for 40 years and was 3 months into retirement when the virus struck. Marty knew she had to help, had no doubt in her mind, so she called her former colleagues and volunteered to work with coronavirus patients. And
coronavirus?
Marty, I'd like you to say a couple of words, please. Thank you.
First off, I'd like to really express the appreciation of all of the nurses up here for having us here today. It's quite an honor. I felt that I needed to get back into the healthcare. I wanted to feel like in some way that we can make a difference. Unlike Luke, I didn't have to sleep in my car to do that. But it's just been a true blessing to be able to go back into the facilities and offer help to not only the residents but to the co-workers who are working tirelessly to fight this wicked virus.
Where do you work, Marty?
I live in West Virginia, but I'm working in Pennsylvania right now.
Great.
Yeah.
That's great. And you go back to West Virginia ultimately?
Yes.
Oh, yeah. Ultimately, she'll go home. Yeah. You're not going to just pull up stakes and live.
That's great.
Yes.
Well, they're 2 great places. Thank you very much.
Thank you.
Fantastic job.
Fantastic.
So the valiant sacrifices of America's nurses will stand for all time as testament to American strength and grace and courage, and
you can't say that without having to read it.
In demonstrating and in demonstration.
Yeah, or get the words right the first time. Maybe skim this before you come out.
Of our everlasting appreciation, I'm pleased to sign this proclamation commemorating May 6th as National Nurses Day. May 6th, National Nurses Day. That's a big deal. That's a big deal. Right now, and I'm going to give somebody the pen, but I'm going to give you all a pen, okay?
Thank you so much.
Deborah knows that.
She gets a pen after every signing. It's a little wider, his signature. You notice that? It gets a little broader.
Here, Luke.
Here,
Here,
Luke.
Marty, take that, Marty.
Marty, grab a pen. Everybody get a pen. I'll hold this up.
Okay. Mike, where's Mike? Do you have anything to say, Mike?
Just very humbling to be among these heroes. Mr. President, I was chatting with a few of them beforehand, and on National
I'm just overwhelmed by your grace and just thanking you for allowing them even in the building.
Nurses Day, I don't think the American people have ever been more grateful of our nurses and our healthcare professionals, not just because of the...
Again, here's Pence just swamping him, just coming in, speaking off the cuff, not difficult.
Extraordinary care that you've provided during the coronavirus epidemic, but the fact that because of the separation that's required with this disease, nurses around America have had to fill in for family members and loved ones as well as provide health care. And so, Mr. President, I just join you in expressing our most profound gratitude.
Well, you're kind of doing it a little more than he is.
The work of our...
He's joining you in your gratitude, I think is how it works.
America, and it's a great honor to be here with them and with you.
We appreciate it.
With them and with you. What an odd thing.
Task force, continuing task force.
Task force, continuing task force. They said we was going to shut down the task force, and so...
Deborah, anything to say?
Well, I'd be privileged to just speak for a moment because I was raised, my mother was a nurse and still is a nurse at 91. My niece is an ER nurse, and I think I was privileged to be able to talk to these amazing individuals because they are individuals, each have an incredible story of what it's been like in the service of others at the front line.
All the sacrificing they've had to do, all the lack of PPE, sleeping in their cars, in cities where Trump has hotels.
I think coming out of this and figuring out not only how to recognize them, but protect them going forward to really ensure that they have the resiliency, because they have been the ones standing at the bedside for every patient that we have lost over the last 3 months. And I think I'm so grateful that you were there for them and such deep service for others, not only your technical abilities, but your compassion for others. I just have such deep respect for each one of you.
And your mother's a nurse at 91.
Well, she's no longer practicing, but she's taking care of the grandchildren while I'm not there.
That's great.
Let's check. Yeah, it says I'm in there. Oh. Is it cycling? No? It's updated. I think it works. Is that right? What is this guy? Yeah, I'm seeing it. Yeah? Okay, good. It never left on my end, so I was just checking it over here. So I will we'll keep that up and running without it being noisy. Okay, phew! Good God. This is so crazy. I'm under constant attack, you understand, by the Ruskies. We're good.
You pass these pens around?
Guys want some pens? Whoopity-doo. Look at them, just fistfuls of pens.
I don't want to mix it up with you.
Pass those out yourself.
No, don't worry, I've got one.
Anybody have anything to say, please?
Anybody over here have anything to say?
I'd like to thank you. I'm Sophia Thomas, president of the American Association of Nurse Practitioners. I want to thank you and your staff for everything that you've done to help the American public, to help the nursing community. I want to thank you for the waivers, the telehealth waivers and things like that. And I think this is an opportunity through COVID-19 to really look at the overall health of our country, look at the health disparities.
And help us use telehealth way more often so nasty, disgusting people don't come in and cough on us when it's completely unnecessary.
See what we can do different.
You want to talk, the pens are definitely vectors. They'll be able to track this back to just about anybody. For the record, like nurses have been pushing for telehealth stuff forever, and the flu numbers that everybody's talking about, like maybe because we wear gloves, maybe because we wear masks, that flu numbers will go down. For the record, one of the things that will change more than anything is using telehealth so that people don't come in and when somebody's in an urgent care or in a an emergency room or at their doctor's office, cough all over somebody with something that they could have stayed home and gotten better at, or gotten a prescription and gone and gotten it directly, or had it even home delivered, so you don't have to leave the house when you have flu. Like, that will cut numbers in this country in half as far as flu deaths.
I think you are in a very unique position to do some very innovative things with healthcare as we look forward on the horizon. So look forward to working with you.
And let us know as you have ideas too.
Oh, I've got lots of them, Mr. President. I've got lots.
I'll put you on the task force.
Talk to her.
Mr. President.
She'll speak to the task force maybe.
Yeah.
I just want to say thank you so much. I'm a faith community nurse, and what that means is we blend faith ministry with nursing. And we work in faith-based community health sites throughout the city.
I work with televangelists. So when they heal someone, a lot of people think it's just a hand on the forehead and the person faints and then they can walk, but a lot of times they require a catheter as well. So I'm there.
And I just thank you for reminding us that what we fight for is God, family, and country. And I've heard you say that repeatedly. And I have the privilege, actually, of being a nurse to be able to serve God, family, my wife Cameron, my boys Joseph and Alan, in this great country. It means so much to me to know that you're recognizing us for serving our country.
Thank you very much.
And thank you for what you're doing in Mrs. Trump as well.
And that's a beautiful cross.
Oh, thank you very much.
Nice. Beautiful.
Thank you.
Go ahead.
Mr. President, thank you so much for allowing me to be here. I represent the Catholic Nursing Association. It's called the NACN USA, but it's also international. It's called CCMs. So I'm blessed to be.
She's got her running shoes on. She's ready. Look at this. She's ready to go back to work. She's not fooling. Her visit to the White House was not. Look at that. Some Z's.
I also represent a community hospital in South Jersey that's considered a hot zone right now in Willingboro, New Jersey. It's called Virtual Willingboro. But the blessing here, sir, is that because we're...
Okay, what is that sound effect? That's crazy. What is it? Is that chat room noise? I'll have to figure that out. Hold on. I'll figure it out. I think it's probably the, it's the Discord making noise, isn't it?
Small community hospital and connected with 5 others, the amount of patients we get are able to spread out, so we're not in one place. In regards to nursing, sir, I have to tell you, we talk about science as a nurse. It's a whole base scientific issue, but it's the compassion part. And the first time that I got involved with a patient with COVID, sir, this patient was so scared, you should have seen her face. But sir, we're all like dressed up, gowned up. We look like we're going to the moon, basically. Right. And so the thing that I noticed is that minute when I touched her hand,
I see.
And then we're gloved and all, but touched her hand and said, "You're going to be okay, man." Looked at right in her eyes, and so she was okay. Right. She didn't wind up on the ventilator. We got her out of there. I know it's prayer. I know it's the compassion of the nurse. It's not just our science. It's our compassion.
That's fantastic.
Excuse me, sir.
That's good. Yeah, I'm glad they're not social distancing or anything.
Please.
I'd like to say on behalf of West Virginia, where I'm from, we appreciate everything that the whole country is doing for us. Right. All the support is fantastic. I was able to leave my home in West Virginia and go to help in New Jersey, which was just completely devastating for me. The loneliness and isolation that our patients and residents felt, and the families, they would stand outside windows and wave at their family members just to have some kind of contact.
Have you ever seen anything like that?
Never in my 28 years.
And yet it's the right thing, right?
Absolutely.
You have no choice.
Absolutely.
Right? You didn't think to maybe bring them inside and...
Well, I thank you for having us.
Yeah, she coughed into her hand, not into her elbow. And she's in the same... Never mind.
For honoring us. And
it's a mess.
Thank you for the help that I know we're going to get.
Thank you.
Thank you.
That's why they're all there. Okay, watch the dude who slept in his car. Watch his hands over the next little bit.
A lot of help.
Yes.
And we appreciate what you're doing. Please.
Hi, I'm Caroline. I'm from Charlotte.
You're twiddling your thumbs. You're in the Oval Office. I mean, who twiddles their thumbs anyways? For real?
So I actually kind of...
Dude is straight up twiddling his thumbs.
A different story. I'm not on the front line, but I have benefited from the telehealth. I work for a clinic here in DC, but I work remotely in Charlotte. So I was kind of overwhelmed with feelings of guilt by not being on the front line and using my skills, because while I love what I do, but I'm not there to really be on the front line. So in my community, I've raised...
He can't stop twiddling his thumbs.
Over $80,000 to kind of give back to those on the front line and support them by providing food and things like that. So while working full-time as a nurse, although from my home, I did everything I could.
Like it's a straight up compulsion.
So I am just so honored. So thank you for having us. And it's such a privilege to kind of represent nurses.
Like he's focused. Look at him. It's a little...
Today.
I'm like a little boy playing with his dick when he's nervous.
I think we all feel that way because it's...
I don't know that it's a tick. I think he's just kind of not paying attention. I don't know that this is a tick.
This is just a small fraction of us, and we all have different roles and do different things.
Now he's reversing. He's going backwards.
It's a privilege, and like...
Is he sending a code? Is this QAnon?
Said, I've never been more proud to be a nurse. It's... And proud of my friends and colleagues.
Watch this. I'm gonna twiddle while this bitch talks so nobody can hear what she's saying. It's just, it looks like sabotage.
It's a pretty amazing thing.
How I feel and how Mike feels. And this is the Oval Office. This is the big, I'm sure you've all been here many times. Right? It's a big deal, the Oval Office. John, go ahead, please.
Mr. President, you mentioned the coronavirus task force. Yesterday, we're told that there were discussions of winding it down.
Good Lord, this is a big hit, you know? You guys probably come here all the time.
Maybe by the beginning of June, you tweeted out this morning that it will continue indefinitely.
Now,
what's the rationale for
tell me from his eyes.
Success, and Mike Pence has done a fantastic job. Whether it was on ventilators, when we started, we didn't have ventilators, and we got them built very quickly, and now we're giving them to other countries all over the world that are desperate for ventilators. There's been...
Now that we know that ventilators aren't the key to helping people with this, we just got excess ventilators, and they need them for other things like tuberculosis and other stuff.
No person in this whole country, in our whole country, that hasn't had a ventilator. If they needed it, you probably saw that. Remember that?
No, they share them. In New York, they're sharing them. Thank you, Julie.
Beginning, it was really tough.
It was.
And we got them built so fast. It was really an incredible...
No, the new ones are all coming next month. We got them bought. The states bought their own. Jesus.
Mobilization. Not since World War II has anything happened with not only ventilators, but everything else. Testing is doing really well. And the task force has done a great job. And I had a meeting yesterday. I had a meeting this morning, probably even more importantly. And so...
More important than the meeting yesterday, the meeting today, we had one as well.
We're leaving the task force indefinitely. We'll see. You know, at a certain point, that'll end like things end.
Like things end, you know, it'll pass away, kind of like when the sun collapses or the Earth is struck by a comet big enough to wipe out life on Earth, or like the dinosaurs died.
But we'll be adding some people to the task force, and there'll be more in the neighborhood probably of opening our country up because.
Yeah. So what he's talking about there is the people he's going to add to this process. Are adorable. These folks are going to, they're more for, quote, opening the place up, meaning less Fauci, more, more Birx, more business.
It has to get open again, and the people want it to be open, but we have to open it up safely. So we'll be adding 2 or 3 additional.
Yes, I do need to get a total black outfit for my glasses and do kind of a Sprockets thing whenever Mnuchin comes on. I don't think he's there today.
Members to the task force. There may be 1 or 2 that will be less involved, that were more involved with the original formation of the ventilator and the ventilator systems, but if they want to stay, they can, because they really did a fantastic job. So
there might be some people leaving, people who did more of the stuff that didn't want us to open, those assholes.
At a certain point, we won't need the test.
No, it's the exact opposite. Birx is there, Fauci is not.
But we're going to leave that. We're going to add a couple of people.
Yeah, ventilator.
And that will, again, be for the opening of...
Dude's still twiddling his thumbs.
We're opening...
Look at that.
Think about it. We're opening our country again. We're the most successful economy in history.
Glory days. He can't run out of people to say this to.
For any country, anywhere in the world. And then they came, I was sitting right here, and they said, sir, I'm going to have to close it. I said...
Jesus, how many times I'm going to do a compilation video of all the times he said, "Sir, we have to close it down." I said, "What are you talking about? Nobody does the..."
What? Basically, we're gonna have to close our country. And just like you said I said, is it important that they not be together? It's not a question, right? It's not a question. You can't have the family together, it's so sad. So anyway, we did something that we did the right move. We saved millions of lives by doing what we did.
By doing anything at all?
But it's unbelievably tough for a country. And most countries throughout the world did something similar.
Yeah, exactly. Like, what is the shocking... Yeah, I'm waiting for 1917 and Scourge as well.
But this affected 182 or 184 countries, and it's a very sad thing. Very sad thing. So we're keeping the task force for a period of time. I look forward to when we can close the task force, because then the job will be essentially, hopefully, over, Mike, right?
Essentially, we're going to close the task force and wow, by the way, he looks well. Holy smokes.
Fantastic job.
Fantastic job.
Could you explain the change between what you said yesterday about winding down the task force and now saying you're going to keep it? Because it is different from what you said yesterday.
Well, I guess if you think we're always winding it down, but it's a question of what the end point it is. But I think it is a change a little bit. I thought we could wind it down sooner.
And then everybody saw that you wanted to shut it down, and it was like, "Hi, you announced that on the day with the most deaths so far," and your PR team was like, "Bad move, bro."
But I had no idea how popular the test.
Basically, let me see. What's a good example? It's kind of like if you were president during Benghazi, and there actually had been a stand down order.
Task force is. Until actually yesterday, when I started talking about winding it down, I'd get calls from very respected people saying, "I think it would be better to keep it going. It's done such a good job."
Yeah, everybody. I started talking about it yesterday about shutting it down. Then all these really smart people started calling me up and said, "Psst, psst, keep it."
Respected task force. It's I knew it myself. I didn't know whether or not it was appreciated by the public, but it is appreciated by the public.
Yeah, the part that we all hated was this nonsense part about you going, "I know better than anybody how this all works. This is so good for me."
When you look at the job we've done on everything, on supplies, on everything, the gowns, the gloves, the masks. You saw yesterday the mask. We were at a factory yesterday, a great company, Honeywell. And in a period of 4 days, they took a big factory, essentially 4 days, a little longer, 2 weeks, but it was really most of the work.
2 weeks, 4 days. What's the difference? Honestly, it all blends together. We're all home.
Done in 4 days.
4 days is 2 weeks. I don't know if you know president math like I do. They call me President Math.
Big plant that did other things, and they converted it into masks. You have to see, it's actually a complicated process, but they have unbelievable equipment.
And I went there to fondle it.
And they're doing millions of masks out of this factory, and that took place so quickly. And that was all because of...
All because the federal government gave them money for a free factory.
Task force. I mean, all of this happened because of the people working within the administration.
This all happened because we actually tried to do some kind of baseline response like you should do in a pandemic.
And something I didn't know, Mike, they take different layers of material and compress it, put it together.
You didn't know that's how a mask is made? Oh my God. How do you think a suit is made?
Because one layer is good.
I know this. They take threads and they weave them in and them and out of a bum.
Something, one layer is good for something else. One layer is good for very tiny particles. I mean, it's really, you think of it as a mask. They make a very good mask. This is really something that's very special. So,
that's how they're made. Oh my God.
The task force will be around until...
Yeah, and then they played Live and Let Die while he was walking around, like, because that's basically the mantra of the reopening committee, Live and Let Die.
I feel it's not necessary, but I will say that I learned yesterday, even after I spoke, Jeff, that...
I don't learn things. Nobody learns anything. Oh, thanks very much, Moto.
The task force is something you knew, it's very respected.
So
People said we should keep it going. So let's keep it going. And so we'll be doing that. But we'll be adding some people to it, actually. We have a whole list of people that want to be on, and we have a list of people that we want. And nobody is, I'll tell you that, I will say this, nobody's ever turned me down to be on that task force. It's very, nobody's turned me down for anything, to be honest.
That's not true. A bunch of people didn't want to be on the reopening committee because they didn't want to be tied to all this.
When we have a committee, like we had the various committees, the sports committee, the commissioners, everybody
The
wants
committee. We had a committee of committees. At one point, they were committeeing.
to be on everything we do. The business committees, it's never had anybody say, gee, I'd rather not be on that committee. You know, it's
Gee, I'd rather not be on that committee. Good God. Good God.
very important. So we'll be announcing, I would say by Monday, we'll be
Dude is still twiddling his thumbs.
announcing 2 or 3 new members to the task force. Okay?
Mr. President, on the issue
And I have to believe it's some sort of witchcraft.
of reopening, it seems little question that by beginning
No, I don't, Aiden, but I will turn that. I'll figure out how to do that on my end. I don't want to do it while I'm doing this at the same time. So, but thank you.
and continuing it, there will likely be more cases of coronavirus, more deaths than there would have been had everything stayed shut down. Will the nation just have to accept the idea that by reopening, there will be more cases, there will be more deaths?
So I call these people warriors, and I'm actually calling now, as you know, John, the nation warriors. You have to be warriors.
We just got to be warriors. You got to be willing to die on the battlefield for your king. You know, Mr. King over here.
Can't keep our country closed down for years.
Nobody's suggesting years.
And we have to do something.
Yeah, and no one is suggesting years.
And
they just don't want you to rush it, and you don't have testing in place. Rush the testing, slow walk the opening. That's what everybody's saying.
Hopefully that won't be the case, John, but it could very well be the case. You won't be locked in a house, and some people should stay if you're over a certain age. I mean, you've seen that, right? Elderly people, or especially elderly people with a problem, where they have a problem.
If they have a problem, any kind of, some of them like have a Rubik's Cube they can't get their way through, or the refrigerator makes too much noise when it's making ice, you know, problems.
It attacks these people viciously. And I think they will be staying back, and we're strongly recommending that they
Old people stay home, young people move out.
that. We're saying over 60, and especially over 60 if you have diabetes or heart problems or
Like the president.
whatever problem you might have.
So you won't be going out, is what you're saying.
But we have to get our country open again, and you see it. Look, you cover it. People want to go back. You're going to have a
Yeah, what they want is one thing. What's a good idea is a completely different set of standards.
problem if you don't do it.
Who cares?
If you don't do it, you've got a very big
How
problem.
close are we to a permanent problem if we don't reopen the country?
Well, I think people won't stand for it. Actually,
You think there's going to be riots?
I don't think our people will stand for it. Now,
Well, tell them to. Maybe leadership would be, people are having a very difficult time dealing with this, and I would say to them, use every bit of patience you have as an American and understand you're saving American lives by doing this. Like, make an attempt as opposed to going, I don't think people will put up with this shit anymore. You know what I mean?
what I really believe people will be able to do is, at a certain age, they'll stay back longer. Because, you know, this virus is going to disappear.
No, it's not.
It's a question of when. Will it come back in a small way? Will it come back in
It's not gone yet.
a fairly large way? But we know how to deal with it
A fairly large way.
much better. You know, nobody knew anything about it initially. Now we know we can put out fires. We can put out, I call them embers, if it's a small or if it's a fire
Or if the whole place burns down.
or a hot spot, we can put it out.
A hot spot. I'll say the house on fire, sir. That's exactly right, Edward. He's like, what we'll do is, before the house is finished burning down, we'll build a new house on top of it. And we'll use children to do it.
But we can't have our whole country out. Can't do it. The country won't take it. It won't stand it. It's not sustainable. And I think you
Honestly, day drunk. Listen to him. It's not sustainable.
have a tremendous transition, which is a third quarter thing.
A third quarter thing. You know, for all of you that have major investments in the stock market, who've been running a disaster econ game plan for the fall, who saw the crash of the stock market and went, who else has cash sitting around that we can dive in?
To have a good fourth quarter. I think next year is going to be an incredible year economically. And with that
compared to this
being said, if somebody lost somebody, a parent,
thank you,
a wife or a husband, or
yeah,
you know, any brothers, sisters, if you lost someone, you can never make up for that by saying, well, you're going to have a great year next year economically.
Yeah, we know.
And so you can never do that. But I will say that from an economic standpoint, I think next year is going to be a very big year.
Well, that's what you just said. You can't really say to somebody who lost a family member that it's going to be a great year next year financially, but I will say it's going to be a great year financially next year. Jesus Christ.
Tremendous demand. You see it with the stock market, where the stock market's at 24,000 and we went through.
Yeah, because the stock market doesn't care about human life. By the way, what is this business right here on is on that side of his head? Like, it's particularly swooping, like, yeah.
The worst attack we've ever had on our country. This is really the worst attack we've ever had. This is worse than Pearl Harbor. This is
oh my God.
Worse than the World Trade Center. There's never been an attack like this.
It's not an attack. It's a pandemic. You let it slide.
And it should have never happened. Could have been stopped at the source. Could have been stopped in China. It should have been stopped right at.
But you were making a deal with China and you didn't want to upset them. And in February, we have actual footage of you going, you know, that they're doing a great job and we're in the middle of making a deal.
Source. And it wasn't. Okay.
That's him getting mad. And it wasn't, okay? And China could have done it and it didn't. Unbelievable. Like,
administration put out. Are you okay with that?
I've given a leeway to the governors. If I see something wrong, we'll stop it. But I have given a leeway to the governors to make that decision. You have some governors, most of whom I have great respect for. They're working very hard. They're watching very closely. But we've given leeway to the governors to make those decisions.
Yeah, they've blown you off, and they're now making the decisions themselves. They sent, 100,000 body bags ordered. Yeah, because they're feeling very positive.
To show unemployment in the month of April could be as high as 60%. Are you worried about that number? Are you also worried that Democrats or Republicans might blame you for it?
There's no, I don't think they can. They're not blaming me. You know, it's very interesting. It's one thing. Nobody's blaming me for that.
No, they're not. You mean nobody's talking to you anymore?
I built the greatest economy with a lot of great
glory
people
days
that we've ever had. And
young girls, glory days. Same exact trajectory slope of the economy as from 2010 and the recovery.
We're going to have a great economy very soon, much sooner than people think. Much sooner. Now, we cut taxes and we do things that you have to do. If somebody comes along and raises taxes and does all of the nonsense that they're talking about, you'll have a crash.
To pay for the debt that we're in, the $6.4 trillion we're going to spend this year alone just for this. The entirety of 18 years of the Afghanistan and Iraq wars in a single year? You mean to pay for that?
It's like you've never seen before. But this was artificially induced. This was a...
No, it picked it up again. He's back to thumb twitching.
Artificially induced unemployment. This was where we said we're taking the greatest economy in the history of the world, because that's what it was.
And they said you got to shut it down.
People in our country, almost 160 million people, we were never closed, and we had to turn it off. One day it turned off. Nothing like that's ever happened before. But by doing that, we have
drunk on the porch telling the same old story.
Saved millions of lives. But now we're going to make our comeback, and the comeback is going to be a very strong one. And I'll be meeting you in a little while because, as you know, we have a very good governor.
Is this healthcare related?
We have a very good governor.
Today is the deadline for the White House if it wants to modify its argument before the Supreme Court about invalidating Obamacare to do it. Will you continue with the plan to completely invalidate the ACA, or
so what we want to do is we're staying. We're not doing anything. In other words, we're staying with the group, with Texas and the group. But just so you understand, Obamacare is a disaster.
We're not doing anything. Obamacare is terrible. All these 24 million people who got coverage, we don't want those people to have coverage. They're Americans. We want them dead, understand? If they can't pull their own weight, they should just die.
But we've run it very well.
Like, it's terrible, but we've run it very well. By trying to sabotage it at every turn, it still saves lives, even run poorly. But please tell me about the Republican healthcare plan that's going to be along any day now. And yes, I think he's skipped the Adderall and went straight to bourbon.
And we've made it.
And by the way, I don't buy the he doesn't drink storyline at all.
Barely.
Not anymore.
Acceptable. It was a disaster under President Obama, and it's very bad health care. What we wanted.
It's insurance. It's not health care. The health care comes from the providers, those nurses behind you, the doctors in the country, the facilities that do it. It's insurance. It makes sure people have insurance. It's not actual health care. It's the Affordable Care Act. It has to do with affordability and the ability for you to get insurance. See, it's not.
It was terminated.
Medicare and Medicaid aren't health care either. They're the payment system by which people get it. You understand?
And give great health care. And we'll have great health care, including pre-existing conditions. 100.
How? How long have we been waiting for this? How long has he been waiting for this? I'm like, or wagging this around. How long? He has been mentioning this. Oh yeah, we're totally gonna get. Yeah, it's
pre-existing
awesome.
Conditions. Now we've already pretty much killed it because we got rid of the individual mandate. Now in getting rid of the individual mandate, which was by far the most unpopular thing in Obamacare, that's where for the privilege of paying a fee, you don't have to buy health insurance at a ridiculous price for not good health insurance. It was a terrible thing. You were mandated to pay something in order not to pay.
No, everybody was mandated to have coverage. If you couldn't afford it, you could apply for help and a tax break if you could afford it, but it used too much money for that. But to make sure that everybody was covered so that when people roll into a hospital without coverage, they drive up the cost, and that's why $800 aspirins, because we're all paying for the people who don't pay their bill by not having insurance. See, that's where that whole thing, and all the benefits, the pre-existing conditions, all that stuff, you can't pay for that unless everybody has insurance. See?
And we got rid of that. That's gone. And nobody thinks it's ever going to come back. But what we are doing is
it's gone. Nobody thinks it's going to come back. But we are going to come up with our own great. When is it?
Terminate health care for under Obamacare because it's bad. And we're replacing it with a great health care at far less money, and it includes pre-existing conditions.
How? When is that going to show up? Has anybody seen the paperwork on this? Honest to God. This is the same crap he's been saying since before he got in office. Not a single sentence of this has come to be. I mean, honestly, if you're a follower of his and you actually think that this moron is a functioning human being and a good leader, where is it? Where is the replacement for the Affordable Care Act? Is it under his taxes somewhere? Is it under everything he says will come in a very short period of time? It's going to be here. Oh, God.
There will never be a time when we don't have pre-existing conditions included. So what I'm saying then...
How do you do it, though? How do you pay for people with pre-existing conditions? Where does that money come from?
We're going to replace Obamacare...
With what?
With great health care...
How?
A lesser price, and pre-existing conditions will be included, and you won't have the individual mandate, which was expensive and terrible and very unfair to everybody, and it was very unpopular.
So how are you going to do that? I mean, is this Medicare for all? Are you now rolling with that? Is that what it is? Literally, how do you do it? How? How do you do that? How do you do that? How do you pay for people with a lifelong debilitating, people with spina bifida who live into their 20s, who are, permanently disabled? How do you not top out what they have? How do people who have fought off breast cancer or women, frankly, who giving birth was considered a pre-existing condition. How do you pay for that? What are you going to do if it's not an individual mandate, meaning everybody kicks in and makes sure that they've got coverage if they can afford it, and you force people who can't afford to have health insurance to get health insurance? There's only one other way to do it: taxpayers. You're going to pay for it with taxpayer money. So if you're going to give everyone below 100%, 115% above the poverty line, anyone below that, free health care using taxpayer funds, tell everybody right now, ridiculous.
General Barr's suggestion to pull back on invalidating the entire act and leave some of it in place, you're not going to go in that direction?
No, I don't know about that suggestion.
I haven't read it. I have 5 sentences that I've been saying since 2015, and even go further back when I was birthering, about better, cheaper, faster, with good stuff and no bad stuff. I just say that, and then if it doesn't happen, I go, well, we'll see what happens.
I think I've spoken a lot about this to Bill Barr, and we're totally...
Because he's who you talk to about health care.
In lockstep with all of the many states that want to see much better health care. See, I don't view it as a...
No, they don't want much better health care. That's not what they're seeking.
I view this as getting great health care.
Yeah, how?
Because Obamacare, we run it really well. I had a decision to make. I said this yesterday.
Uh-huh.
We took over Obamacare. We got rid of the individual mandate, which basically was the end of Obamacare. In a formal sense, it was really the end of
No, it wasn't.
Obamacare. And few people are challenging the fact that we can do that. So we got rid of the individual.
And it blew a hole in the budget for it.
Mandate. I had a decision to make. Do I want to have Obamacare run as well as it can run? Or do I want to have it run really badly so everybody could say Obamacare is terrible?
That's an option in his head. That was in running through, who admits that in their life? Who goes, one of the possibilities is I could just run it like shit and just let people die and then blame it, which is basically what they tried to do, but it had enough protections built into it that it kept sailing.
Politically, I could do the other. I should let it run badly. But I can't do that because I'm president for the people. And
yeah, I can't just, it's aggravating. I can't just let Americans die en masse.
We ran
aggravating.
It much better than President Obama ran it, much better than the last administration ran it. Seema and Alex and everybody, and spent a lot of money in running it properly. It's still not good. It's still not good. But I had a decision. Do I want to run it great, or do I want to run it really badly?
Literally, this is the whole thing. We could have had 2 million people die if I'd have just let it ride. P.S. We've been doing this bullshit long enough. Can we just let it ride now?
Politically, I should have run it really badly, but I'm glad I made the decision to run it great. But running it great, it's still lousy health care. And we are going to do something that's going to be great health care.
When's that coming? Oh my God. How long have we been hearing this? How long? 6 years? Any day now.
Always including, always having.
Pre-existing conditions. Why? Why? Do you really think that? Because you view pre-existing conditions, the Republican Party's position on pre-existing conditions is their exact issue with people who will die of COVID-19. Well, they're weaker than most people, and we got to burn out a few of them to get our economy going again. That's what that is.
Again, the individual mandate gone, and pre-existing conditions will be taken care of. So I'm glad you asked me that question.
Yeah, how? How? Same question I had for Bernie Sanders. How?
Yesterday, we went to Arizona, and you had said before the trip that you would likely wear a mask at the mask factory. You ended up not wearing one.
Well, I actually did have one, no.
I did wear a mask. I was wearing a mask. You just couldn't see it was invisible mask.
Yeah, I had a mask on for a period of time.
We didn't see you with a mask.
Well, I can't help it if you didn't see me. I mean, I had a mask on, but I didn't need it. And I asked specifically the head of Honeywell, should I wear a mask? And he said, well, you don't need one in this territory. And as you know, we were far away from people.
Yeah, you're just handling sterile masks. You're both fondling them.
From the people making the masks. They were making the masks. But I did put a mask on, and it was a Honeywell mask, actually. And I also had a 3M mask, and I had about 4 other masks. But I did have it on. I don't know if you saw it or not, but
Nobody saw it. Why would they ask you why you didn't wear one if anybody saw you wearing a mask? And what'd you do? Just hold it up to your face and go, does it go on like this? And then put it back in the thing for somebody else to get with spit inside of it? Oh my God. I had it on for a couple seconds. I held it up and I went, look, I'm a dummy in a mask. And then I put it back on and then I was like, look at me, I'm Mike Pence.
not too long, but
Sorry if the mods are being unfair. It's a thing in that. It's not in here though.
I had it on. I had it on backstage. But they said you didn't need it, so if I didn't need it, and by the way, if you noticed, nobody else had it on that was in the group, and they were the people.
That's leadership.
The workers had them on. Yeah, the workers were there. Yeah.
The workers had it on, but the executives and you walked around without them. That's interesting. That's really interesting. So the people in the factory. Let me get this right. The people working in the factory, making the stuff that you were looking at, were and touching and fondling and holding up to your face and going, is this it? They were all wearing masks and gloves, and you weren't. Okay, good. All right.
Working next to each other.
Right, yeah, and they're touching sterile masks that are going out to the public.
Right.
What kind of message does it send?
Oh my God.
Surrounded by nurses who are not doing social distancing, who are not wearing masks. What kind of a message?
Well, I can't help that. I mean, look, I'm trying to be nice. I'm signing a bill, and you criticize us.
Oh my God. Like, they're not doing social distancing. Have the people, just say, have they been tested? Like everybody here's had a test. We're not giving an example right now. One of the examples we're giving is that once people have been tested and they're in a space after they've had one of these tests, he could tout the Abbott test right now and not come off as an asshole. But
look, here's the story. There's nothing I can do to satisfy the media, the Democrats, or the fake news, and I understand that. We did the greatest job mobilization in history with the ventilators, and I don't think there was a story what a great job we did. Now we're helping.
You're 2 months behind. They were sharing ventilators in New York. Now they recognize that the longer they work to keep someone off and the other interventions that they have actually will save people's lives. But going by what was going on in Italy and South Korea and China, there was a big focus on ventilators in the early part of it. That shifted. Where are the tests?
Germany, and we're helping many other countries, France.
And they're not using them for COVID-19. They're just glad to have ventilators.
Spain. And
Spain.
Italy, by the way, and Nigeria, sending 250 to Nigeria ventilators. And 2 months ago, we didn't have any ventilators for ourselves. The cupboards were bare, right, Deborah? They were bare. People have no idea.
They weren't bare. You were president for 3.5 years before you even bothered to look.
There's not a thing I can do to satisfy the fake news, and there's not a thing I can do to...
I got news for you. If you hadn't dismantled the pandemic response team and you had not gotten rid of the maintenance contract for the ventilators that you had in storage and refurbished the mask, gown, and PPE in general that are in those storage places, which you have to rotate through because they go bad over time, nobody would have been able to criticize you. You would have been able to point to things 2 years ago that you did that are good instead of things 2 years ago that were horrible.
Satisfy Democrats.
There's nothing I can do. Nobody knows the trouble I've seen.
Watch this phony Chuck Schumer. Everyone in New York knows he's a total phony. He's
a total phony.
Nothing back to New York except salt. You know what salt is? Bad tax policy. He brought salt back. He didn't even fight it. I watched him the other night on a show, and all he could talk about was...
All I'm doing is watching TV. I watch a lot of TV. The other day, I had TV on.
Testing. And yet I showed a chart yesterday where our testing is far superior to anybody else's testing.
No, you didn't. You held up a piece of paper. That was at the ABC interview. Oh, God, that's gorgeous. He pulled it out of his jacket, and he's like, look at this chart. And it's the It's the numeric chart, not the per capita chart. The per capita chart would show us that we're behind Belarus and that, like, Italy is swamping us in the number of tests per capita. Like, it's hilarious.
And then the other thing is very interesting. Because we did so much more testing, we have more cases. If I did little testing, we'd have practically no cases. So the headline was, we have more cases.
That, he thinks, by the way, that the reason we have more cases in the United States is because we're looking. This is the ravenous bug bladder beast of Troll. He thinks if he can't see you, you don't exist.
Than anyone else. Well, China has more cases than us, and other big countries. You know, you're talking about big countries.
Yeah, countries with 1.3 billion people in them. Like India. By the way, China, I personally believe, tops out at 600 million, but that's another story for another time.
But they don't want to choose, they don't want to use that. The fact is, we've done better testing, more testing. In fact, we've done, as of 2 days ago.
If we didn't even look in these people's apartments, we wouldn't even find them dead of COVID-19, but the stupid Democrats want me to look.
So,
what is this? What, honest to God, this is his, like, it's only because we're looking that we're finding.
More testing than the entire world together.
Not true.
You would add.
Not even close to true.
Every country.
Nope.
Every country together.
No. Even the little chart he has in his pocket proves that's not true.
Done substantially more testing than the entire world together.
Nope.
And all I get is, oh, we have more cases. You understand that? We have more cases because we do more testing. If I don't do testing, we don't have any cases.
No, that's not true. That's not how it works. That's not how it works. You have more cases than you know about because you haven't tested them. Look at this man's face right now. Look at him mid-argument.
So as I do more testing, they say, but you have more cases.
Whoops, we blacked out for a second. What's happened? Hold on. Oops. Hang on. Reload. I see it in there. What's happening? Why does it go black? Let's see. There we go. Okay, it's buffered. It's coming back. All right. Oh, it jumped back. What is this? What's happening? Stop that. Stop it. Why does that freeze on there? It's so odd. And I'm not getting any lost stuff. I don't get it. We're fine. That's the buffer that happens when that comes back in. Son of a... There we go. Hold on. We'll get up and running in a second. Hold on. This gets so weird. Why? Okay, that's coming out of here. Hold on.